Hi friend, this is Dr. Apurv Mehra. I'm talking to two set of students together, the orthopedics residents and the surgery residents. Conceptual orthopedics and conceptual surgery is covering the videos, the theory content and the MCQs in their respective areas for both the apps. One of the commonest question to the upcoming theory exams, how to score better. Number one, manage your time, think about it, how to divide it. Number two, do not deviate from the basic thing that you want to talk about. Have a very simple to the point answers, keep them clean. It is just like if you go to a new room in a hotel, you will like it to be well organized. Similarly, an examiner, while having a look at your sheets, will like them to be tidy, clean, well organized, to the point. Number one, if you have maximum time per question, so you have the total time for the paper, total marks, and the weightage of that question. When you look at this, average is 90 seconds for 1 mark. And you finally will have to go to the revision of what you have written. So 3 hours is 180 minutes. So you have about 150 minutes for 300 marks. So about 90 seconds for each mark. That's how you score it. So keep a mental check that don't get stuck up in a question. Divide your time wise. Number two, the rule of medical sciences, never leave anything. Attempt everything. For attempting a question, you get marks. So do not leave it empty. Try to go in the order 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do not mix them up because the examiner finally has limited time to check. Your start of a paper, the first question should be very clean and tidy. It's like a first impression. A lot of idea an examiner will get about you right at the beginning. There should be proper spacing between the questions so that while doing a quick check, no question is missed or not marked. Try to start a new answer from a new page. Do not leave the blank sheets, that irritates the examiners. Proper handwriting is advisable. Starting your sentences with a capital, spacing in between the words is advisable. Avoid cutting. Avoid overwriting. This is all making it untidy. Do not try to use too many colors. Do not try to put red colors into the questions. You can use colors in some diagrams, but there is no added advantage of making your answer sheet colorful. Do not highlight things. You can underline with the same pen that you're using on the keywords. And if you highlight the keywords, the examiner understands this candidate has a fair idea about what he's talking. Do not try to just highlight for the sake of doing it. Do what you are sure of. Try to write in proper bullets, orders, numbers, some diagrams, some flowcharts. Long paragraphs are not encouraged. Understand what they are asking. If they are talking about enumerate, management, or discuss, you should be answering specifically what they are asking. Be concise, save the time, use your answer sheet judiciously. You will not get extra marks for filling up the sheets. But In fact, if you try to write extra in which you are on writing something, your marks will be deducted. If they are asking you management, for example, write investigations, write the diagnosis, and write the treatment. It's everything. If they are not asking you detailed operative steps, avoid it. And the crux of things, diagrams and tables are easy to clear your answer and easy for an examiner to evaluate you. Try to attempt papers. Give some mock exams. Some questions, if you're not sure of, discuss with your teachers and mentors. But have a clarity, because whatever is asked, you must know that very well. If you're not sure, go to the question again. Subdivide the question. You can know answer to some part of it that you can get marks on. Imagine what exactly will they ask you. What is the gross thing they want to know? The rule is always the same in medical science. You have to learn common things, answer common things. You will commonly pass. Don't enter the zone of rare things. Friends, I will like to tell you, it is difficult to not pass. It is easy to pass. The rules are simple. Read the question carefully. Answer to the point. Write some diagrams and flowcharts. Make some tables. Never leave anything empty. If you stress upon some key points which are relevant to the question, you will score better. It is better to be specific rather than trying to be non-specific and losing marks. This is, in short, about the examiner's mindset, what they expect from the candidate. I wish you all the best for your upcoming theory examination. Thank you very much.